Welcome to a new episode of Science in Context. I'm Sabine, and this week, Camilla Llanes-Kidder and Dr. Thom Rawson join me to speak about transmission of COVID-19 across England. Tom, there's a lot of data available on COVID-19. What stood out that made you have a closer look?
So people probably remember that graph of the number of COVID cases over time in England. But when you zoom in really close to specific parts of the country, you can see completely different patterns in the number of cases. Our question then was, what's driving those differences? So to do that, we looked at this huge data set of all the different ways that places in England can be different. It's age, demographics, deprivation, mobility, all sorts of stuff. Now, for cases, what we found is this was predominantly a spatial factor, hotspots of disease spreading out into the country. I think what's really interesting though is what Camilla's done.
So you matched this data with vaccination coverage. What did you find there?
Yes, we noticed a few demographics in these local authorities that showed lower uptake and higher dropout rates. One of these was age, so areas with younger populations, and this seems to be due to competing priorities such as work commitments, as well as a lower perceived risk of health. Additionally, we noticed, for example, ethnicities, areas with a higher proportion of Black Caribbean and Asian populations, which could be due to historical mistrust in healthcare systems, as well as some cultural concerns. And the last big one that we noticed was deprivation, so areas which had higher deprivation, which again could be due to some financial constraints or accessibility issues, as well as broader social factors which could be impacting this.
So these are really important findings. What does it mean now going forward?
So I really hope these findings can be taken into consideration for future vaccination campaigns. I think if public health teams can look at their local demographics and take those considerations into future strategies, it can ensure that we maximise uptake and reduce dropout rates and targeting these hard to reach groups.
Thank you both so much for your time today.